The Case of Sarah, a group narrated presentation. Welcome. Thank you for joining our presentation. Today, our team will explore how culturally responsive counseling plays a crucial role in understanding and treating clients with complex mental health needs. Using Sarah's case as a foundation, we are challenged to examine how the same presenting concerns might look differently through three different cultural and ethnic lenses. First, a Latina client with a middle class Catholic background. Second, an Asian refugee from a poor Buddhist background. And third, an Arabic American client from an upper middle class Muslim background. The purpose of this project is not only to summarize Sarah's symptoms and history, but to demonstrate how cultural influences the way clients experience distress, interpret their struggles, and have access to help. Through this presentation, we will highlight how stereotypes, family expectations, socioeconomic factors, and community norms shape a client's mental health experience. Ultimately, our goal is to show how effective counseling requires flexibility, cultural humility, and understanding that treatment must be adaptive, not standardized, to truly meet the requirements for all diverse clients. A summary of the case of Sarah includes that she is a 20-year-old from Texas, the youngest of five. She's anxious, shy, and a perfectionist. She has a medical history including asthma, food allergies, family history of anxiety, depression, substance abuse, and attention issues. Emotional decline began in the fourth grade during parent separation. Cutting, depression, suicidal ideations, and brief counseling took place during that time. Ongoing symptoms: social withdrawal, fluctuating depression, long standing sleep problems, periods lasting from 1 month of elevated energy, little to no sleep, talkativeness, distracted, racing thoughts, and not substance related. She was diagnosed with ADHD in middle school. Recent stress includes her parents considering divorce, a move to Dallas, withdrawal from Tulane, interpersonal conflicts with peers, no close female friends, and feeling judged or alienated. She continues to have panic attacks, vomiting after eating, and obsessive weight concerns. She has taken part in marijuana abuse, heavy alcohol use, and has a recent DWI. Described as brief but emotionally sensitive, difficulty with long term commitment, and she hopes to pursue a fashion career while working odd jobs. This slide was completed by Chasity, voiceover by Jade. Her hypothesis surrounded a Latina woman from a middle class Catholic background. The stereotypes faced was Sarah may feel pressured by stereotypes about Latinas being emotional, dramatic, and overly strong. These stereotypes can make her afraid to show weakness or ask for help. Sue and Sue 2022 explains that ignoring a client's culture experience can lead to micro invalidations where her feelings get dismissed. Influence of family. She comes from a Catholic middle class Latin family. There may be strong expectations to be polite, responsible, and not create conflict. Family comments or pressures to hold it together can also increase her stress. According to Rodriguez 2025, Latina women often rely on family first and avoid professional help because of the stigma and fear of judgment. Potential results on mental health. These pressures may increase her anxiety, depression, and perfectionism. She may hide symptoms, isolate herself, and cope in unhealthy ways like drinking or marijuana use. Feeling misunderstood at home and stereotyped by others may deepen her low self esteem. Resources for her would include faith community, Catholic beliefs, youth groups, and spiritual mentors, family support through the high valued and Latino culture to be a source of support and safety, personal strength, strong student, creative, motivated, and her aspirations to have a future in fashion. The social support would surround Latina focused social groups, Rodriguez 2025 found that community based programs designed for Latin women increase engagement and reduce fear about seeking help, making these programs a strong option. Treatment would center around cultural humility, being open, curious, and respectful to her culture and Catholic identity. Build trust slowly since she has quit therapy before and may feel judged, and validate her feelings. The Latina client main therapy goal. In therapy, the main goal for Sarah would be to help her better control her anxiety and panic attacks by using grounding skills, calming techniques, and working on a healthier sleep routine. We would also spend time helping her understand herself better as a young Latin woman, explore her family expectations, cultural values, and stereotypes that have shaped the way she sees herself. Because she often uses alcohol and marijuana to cope, part of therapy would focus on finding healthier ways to manage stress and slowly reduce substance uses. Building a strong support system would also be important, especially since many Latin women tend to lean on family before seeking professional help and avoid treatment because of the stigma and judgment. We would also begin small steps towards a long term dream of working in the fashion industry to build confidence and move towards an open goal.
In this case, I'm considering how Sarah's identity as an Asian refugee from a poor Buddhist background may influence both her social experiences and her mental health. Individuals from refugee or immigrant backgrounds often face stereotypes that label them as quiet, compliant, and academically perfect. These expectations can clash with Sarah's lived experiences, especially as she deals with anxiety, mood instability, and significant stress. Within her family, cultural values around emotional control and endurance may make it harder to express distress openly. Her parents' separation, ongoing conflict, and frequent school transitions may have added pressure to stay composed instead of seeking help. This combination of societal stereotypes and family expectations can contribute to internalized shame, self doubt, and fear of being misunderstood. We see this reflected in Sarah's symptoms: chronic anxiety, depressive episodes, panic attacks, sleep disruption, and racing thoughts. Her difficulty maintaining friendships and her tendency to withdraw suggest that she may not feel safe or accepted by peers. The disordered eating patterns, substance use, and perfectionism may also be attempts to cope with overwhelming internal pressure and the belief that she has to succeed despite emotional pain. For interventions, it is important to draw on both culturally informed resources and strengths that already exist in Sarah's life. Community based Asian American or refugee support organizations can offer validation, identity grounding, and a place where she does not feel misunderstood or judged. Buddhist based mindfulness programs may also support her healing by helping her regulate mood, build awareness, and reduce distress. She may already benefit from the support of her brother, who is providing a more stable environment while she navigates this family conflict. Expanding her social support is essential, including peer groups for young women, mental health support groups, and creative communities connected to fashion where she can feel more confident and express herself. In therapy, my goals would be to focus on stabilizing her mood, strengthening coping skills, and building self confidence. I would explore how cultural expectations and family dynamics have shaped her identity and emotional patterns. We would work on reducing harmful coping behaviors such as substance use while helping her develop healthier strategies. Another key area would be rebuilding safe relationships and helping her form a supportive social network so she feels grounded, understood, and less isolated.
Client is an Arab American from an upper middle class Muslim family. With this client, I would like to focus on interventions and resources that honor her Arab American identity, her Muslim faith, and her upper middle class upbringing. She has several meaningful supports that could aid her in her healing journey. Her mosque community, such as a women's help group, youth programs, and guidance from elders, can offer spiritual grounding and a sense of belonging. Because of her socioeconomic status, she also has high access to quality healthcare and educational stability. Connecting her with Arabic speaking therapists or a culturally responsive mental health provider would help increase trust and comfort in her therapeutic process. In addition, Muslim and Arab focused mental health programs can reduce stigma and make seeking her help feel safer. I would also draw on this strength as motivation. Goal driven student and integrated faith based programs, coping strategies that would align with her values. She may also have strong social support, given that she does have several siblings at home who have been through similar life challenges. Family involvement can be a powerful protective tool when approaching cultural sensitivity. So, family included counseling could be beneficial if appropriate between her, her siblings, and her parents. Support groups specifically designed for Arab American and Muslim women can give her a place to share experiences without fear or judgment. A peer program for young adults dealing with anxiety or depression can also reduce her feelings of isolation. In therapy, my approach would be grounded in cultural humility and a deep respect for the multiple identities that she holds. Building trust gradually would be important, especially if she has felt misunderstood in the past with therapy and moved around several times without lasting connections. I would focus on validating her emotions and exploring the cultural and religious context of her stress, whether that involves academic pressure, family expectations, or just navigating a bicultural challenges while moving. Key goals would include improving emotional regulation, strengthening her coping strategies, and helping her balance her personal aspirations, including and involving her culture and religious values. Overall, her treatment would be strength based, culturally attuned, and collaborative to support her healing while honoring her multiple identities in her community. This slide was created by Miss Edwards, and the narration is being done by Jade. Interventions and resources surrounding the client whose background is Arabic um, from an upper middle class Muslim background. The culturally responsive focus would be to honor her religious values, gender norms, and family roles, to build trust before exploring sensitive topics. Potential resources: Muslim Students Association, um, community counselors for spiritual guidance, faith aligned coping strategies, prayer, reflection, community involvement, university mental health services with culturally trained staff, and online Muslim mental health networks. The therapeutic approach would be strength based focus on resilience, faith, and identity, culturally adaptive CBT, cognitive behavioral therapy, to address anxiety and internalized pressure, collaborations with family only if client express consent, psychoeducation to reduce stigmas around counseling, support identity integration, her American Muslim identity both being valid, and her treatment goals would involve improving coping with academic and cultural stress, increase confidence in help seeking, reduce self-blame and perfectionism, and strengthen community ties and belongingness. The case of Sarah and exploring an individual of similar circumstances with three different cultural identities has allowed us to understand that culturally malleable counseling is essential because the same clinical symptoms can manifest differently across culture and ethnic backgrounds. Sarah's case illustrates how factors such as family expectations, cultural stigma, coping styles, and access to support are shaped by culture. A Latina, an Asian refugee, and Arabic Muslim American client each require a tailored approach that would respect their faith, values, and community norms, plus their lived experiences. Effective treatment involves adapting interventions, communication, and therapeutic goals to the client's cultural context. When counseling and culturally responsible, clients need to feel understood, which enhances engagement, resilience, and long term healing. Thank you so much for taking the time to review our presentation on the case of Sarah through three different cultural lenses. This is our reference sheet. Have a great day.